Let's start with an overview of the Supreme Court decision as it impacts what you have to do. So I'm going to turn that over to my friend Bill.
Let's remember the big building blocks of the Affordable Care Act, virtually all of which take effect in 2014. So we're still looking prospectively. What are the big building blocks? What was challenged? Where do we stand? Big building blocks. One, the creation of state-based exchanges on which commercial insurers will offer commercial products that contain the essential health benefits package to enrollees. Who is potentially eligible to enroll? In theory, just about anybody is potentially eligible to enroll. Excluded individuals include those eligible for Medicare, those eligible for Medicaid, illegal aliens, and certain persons under incarceration. Second big building block, under certain circumstances, if you choose to enroll and to purchase a policy through an exchange, you, as an individual, may be entitled to a tax credit. The credit works in an odd way. It works backwards. Based on your income, you are expected to make a contribution toward the premium. As your income increases, the expected contribution that you must make increases. The credit covers the rest of the premium cost. Remember, you are buying a policy on your own, just like buying automobile insurance. Who is eligible for the credit? Anyone whose family income is at least 100% of the poverty level, but less than 400% of the poverty level. What's the poverty level? For a family of four today, it's around $22,347, give or take. So for an average family, 100% of the federal poverty level, $23,000, give or take. What's 400%? Now we need an accountant in the room. It's about $89,946, give or take. So if you're in that range of family income, you're entitled to a credit. Remember, as your family income increases, your expected contribution increases. At the bottom end, you're only expected to contribute 2.5% of your family income. At the top end, if your family income is approaching 400% of the federal poverty level, 400%, you're expected to contribute 9.5% of your family income, and the credit pays for the rest. Third big piece, changes in employer-sponsored plans. There are new obligations that all employer-sponsored plans will have to follow. For example, fully insured plans, which heretofore have been allowed to operate in a discriminatory fashion. I could discriminate as to who I allowed to participate, will not be able to do that. They must operate in a non-discriminatory fashion, both as to eligibility to participate and to benefits. How many of you currently are involved with or participate in a self-funded group health benefit plan? You are already following these rules. The rest of you will now have to live with rules similar, that's the phrase in the statute, to those that you in the self-funded world are currently following. Next big piece, the individual pay or play mandate. Individuals, you must either enroll in an exchange plan or enroll in your employer's plan, or you must pay a penalty. That was challenged, and we're going to see in 35 seconds what the Supreme Court said. Next big piece, the employer pay or play mandate. Employers, if you're an applicable large employer, a word to the wise. Wherever Leslie and I use a phrase in the English language, it is a defined term, and it doesn't bear its usual and customary English meaning. So wherever you hear a phrase in English, just keep that in mind. If you are an applicable large employer, you must either offer an employer-sponsored group health plan to all of your employees who are full-time, or you must pay a penalty. And even if you do that, even if you offer a plan to all of your full-time employees, if the plan doesn't offer minimum value or is not affordable, you must pay a penalty. Fifth and last big piece of the act, expansion of Medicaid. What was challenged before the Supreme Court? Of those big pieces, what was challenged? Piece number one, is the individual mandate constitutional? Answer, yes, it is constitutional. It will be enforced. Second big question, was the expansion of Medicaid constitutional? Now, here's how Congress expanded Medicaid. As you probably know, Medicaid is a state and federal partnership from a funding standpoint, under which states operate governmentally sponsored, state-sponsored health benefit plans for poor citizens and for certain disabled citizens. In order to be eligible for Medicaid coverage in most states today, you must either be a child under the age of 6 years old, a child between the ages of 6 and 18 years old, or an adult with dependents that fall into one of those two categories. If you don't fall into one of those three categories, no matter how poor you are not eligible for Medicaid today. Even if you fall into one of those two categories, if your family income exceeds a certain percentage of the federal poverty level, you're not eligible for Medicaid. Today, for children and for parents of children under the age of 6, the threshold after which you lose Medicaid eligibility is 100% of the federal poverty limit. So when you go over 100% of the federal poverty limit, you lose your Medicaid coverage. If you are an adult with a child over the age of 6, many states cause you to lose your coverage when your income exceeds 64% of the federal poverty level. If you are an adult with no dependents, in all but about 12 states, you are not eligible for any Medicaid coverage. What did the Affordable Act do? It expanded Medicaid coverage to cover every citizen of the United States with Medicaid coverage as long as their income did not exceed 133%. Technically, there's a 5% window, 138% of the poverty level. Do you see the big expansion? First, one group that's affected are those whose incomes are below 100% of the federal poverty level, but they're not currently eligible for Medicaid coverage. Second group, people whose incomes are between 100 and 133% of Medicaid, and who have never been eligible under most states, are now going to be eligible. How is Congress going to encourage states to expand? Under the Act, Congress has said the federal government, instead of paying for only 50% of the costs, its traditional cost sharing for Medicaid, Congress will pay for 100% of the costs, but that's only guaranteed for 5 years. In order to bludgeon states to expand their coverage, the Act says, if you don't expand, state, let us pretend you are a mythical state, Ohio. If you don't expand, we, the government, have the right to withdraw all of your Medicaid funding. That's quite a club, isn't it? What did the Supreme Court conclude? Congress cannot attach too many strings to funding dollars. They held that penalty provision unconstitutional. But the Supreme Court sustained the rest of the Act. As a result, states now have a choice, and that choice will not affect their funding for Medicaid as it stands today. They can either A, expand their Medicaid coverage as per the Act. The federal government will cover the costs for at least 5 years. Who knows what will happen thereafter? Or the states can elect not to expand. If you are involved in an industry with a substantial number of low-wage workers, we need to be concerned about this. As you're going to see, when we come to plan, many of us were hoping that the states would expand their coverage and that new workers who we would have to otherwise offer coverage to, we could funnel to Medicaid. Now we can't. Or we might not be able to, depending upon what the states do. Exchange subsidies. Remember, we talked about that premium tax credit. In order to be eligible for the credit, your employer must not sponsor an affordable plan, and you must have family income between 100% of the federal poverty level and 400% of the federal poverty level. Now notice what happens if a state chooses not to expand Medicaid. Let's assume you are living in Ohio, and your family income is 99% of the federal poverty level. Notice today, you might very well be eligible for Medicaid, but you might not if you're an individual without a dependent, or if you're an individual with a dependent over the age of 6. In most states, you're not eligible for Medicaid. If Ohio chooses not to expand, you're still without Medicaid, correct? Is she eligible for the tax credit if she goes to the exchange? In order to be eligible for the credit, your family income must be at least 100% of the federal poverty level. Why did they write the statute that way? Because they assumed all the states would expand their Medicaid coverage and cover everybody up to 138%. But that isn't going to happen, which means you're screwed. You are not entitled to Medicaid if the state doesn't expand it, and you're not entitled to a tax credit, which means you have to pay the fake list price for the insurance. That's a problem, correct? We're going to have to think about how we plan, particularly when we talk about the employer pay or play. Remember when we get to the employer pay or play mandate in 42 minutes. Think about those of you with a substantial number of full-time workers who are making less than $11.45 an hour. That's the problem group. And we'll analyze that in a moment. Remember, see that gap? That's the gap we're going to analyze.
So 2 things to consider, because I was very clear that we were not going to have a political discussion, but we've timed this brilliantly. So for those of you who get the Inquirer, editorial page yesterday, editorial page today, full discussion about what the cost of having uncovered Medicaid eligible individuals in our community will transfer to providers and hospitals. So the great handshake that happened a couple years ago in support of PPACA is now, we have to figure out the math on that, who's going to pay for what. So there was an assumption that it would be funded because everybody would have coverage. And as Bill just identified for you, there's going to be this gap, and we have to figure out what that gap is going to cost and how we're going to absorb it into the population. So think about that, but there's some great reading on it. This is the easy part. So you have been very busy for the last 2 years because you've done everything on this left-hand side of the slide. You've either been grandfathered or not, and you've covered adult children, and you figured out your prescription plan and your HSA contributions, and you made your plan changes, and you either went fully insured or self-insured to avoid or include whatever it was you desired. So that's all been done, and the good news is you're all here today. So you lived through all of that. It's been a busy 2 years. You did great. You know what? It's going to be a busy another 18 months. You will get through this as well. So this is what you got to get ready to do. And most of this is in pretty short order. So many of you should have started receiving medical loss rebate checks if you're entitled to that. That is for fully insured groups. And that is based on the fact that the fully insured insurance pool that you're in, so that's by carrier, Anthem, United, Humana, whatever, that fully insured pool did not spend enough money on medical care. So the deal is, depending on the size of your group, the carrier needed to spend between 80 and 85% of your premium on medical care. If they spent less than that, you get a rebate. Checks are literally in the mail. Guidance has sort of come at the same time as the check, so just in case you don't know what to do with them, we're going to talk about that later, but you have to share that rebate back with your employees. So a couple slides from now, I'll tell you how to do that. W-2 reporting, you probably have been collecting information all this year on the value of your health plan. You've got to make that available to people starting in January. It's not at the end of the year. It's not the end of 2013, because if I work for you and I leave and I want my W-2, you got to give it to me. So you've been collecting all of that data. That needs to start showing up this year. We're going to spend some time on my new favorite, which is this SBC, the summary benefit documents that you have to make available at open enrollment starting with plan years after September 23rd of 2012. That would be this year. If you are renewing in October, you have to do this. If you are renewing in January, you have to do this. This is kind of a big, complicated deal, so we'll spend some time on that. Comparative effectiveness research fees, you just got to pay them. There's nothing for you to do other than to know you have to pay them. I'll tell you how to pay them and how to budget for them. We're going to spend a little bit of time on the Medicare tax on highly compensated employees. This is a big deal from a communication standpoint. There is nothing for you to do. The tax is the tax. It will be applied appropriately. But my suspicion is all of you represent executives in your companies who will trigger this tax and who may not be aware of how it is to be applied. It would be really good if you looked really smart next week and let them know that this was coming down the pike. And this will start next year. You're going to limit your FSAs, and you've got more communications opportunities because you're going to have to tell people about the exchanges come this spring. So that's all the stuff that you got to get ready to do. Medical loss rebates. Figure out which pool you're in. If there's a check mark, you're getting a check back. Here's what happens with that. The checks come to you, the employer, and if you, the employer, were not able to fund 100% of your employee benefit plan, so if you had some cost sharing going on, you paid 80%, they paid 20%, you paid 70%, they paid 30%, you have to refund on a pro rata basis back to your employees.
What do you do if you're a consumer-driven health care plan and the percentage ratios are different between the varying plans, and you have to switch plans in mid-year because of life events?
Life events. You want to take that one?
Be reasonable. There is
Oh, I'm sorry, let me repeat the question. So, if you have a consumer-driven health plan, as part of your offerings, you have multiple offerings, people change plans throughout the year based on life events, qualified life events, and your contribution level varies by plan. Oh, and let me just throw in one that you didn't ask. You have a wellness program, you have a big wellness initiative, and you vary premiums based on people's participation and maintenance of good health. So let's just wrap that all into one question.
And there is a DOL interpretive guideline that came out when demutualization occurred and your group life insurance plans received demutualization proceeds. And remember what it basically said was good faith, reasonable interpretation as to how you're going to allocate the employer's share of the premium to the employee's share and who you identify. As long as you do it reasonably and in good faith, you're okay. Same principles apply here.
So the English version of all of that, you are not going to go to benefits jail if you get it wrong, trust me. The worst that could happen is there might be some penalty, and we don't anticipate, although we don't know, we don't anticipate that to be huge as long as you've made an effort to do that. But if you want to adhere to the letter of the law, some of the complications are you would technically owe money back to people who no longer work for you and for whom you might not have addresses. So you just want to think about that. You also have this de minimis exception that we talked about this morning, which simply says it's going to cost me $7.50 to cut a check to send you a check for $2.50. So is that really a good use of everybody's time and money? And so the answer again to that is not. So this is the business risk. What's the risk that you get it wrong and that there's any consequence of magnitude that you care to deal with? That's a business decision for you to make. But you've got to understand it in order to be able to make that decision. You can utilize the rebate to fund a premium holiday on a going forward basis if you choose to not want to distribute. That's kind of a nice thing to do. And yes, I understand that that rebate that should have gone to somebody who no longer works for you accrues to somebody who now works for you. That's life. Things like that happen. You cannot I get this question a lot, you cannot put the rebate in people's HSA accounts. That is not yours to distribute that way. You've got to give it back to the employee technically and let them. So that is one of those things that you just have to do. And rebates will be due from everybody who's entitled by the end of August. So you've started receiving them. They will be due to you by the end of August. And should you remain fully insured on a going forward basis, we can do this exercise every year. Just saying. Okay. W-2. You started collecting that data. Just a quick refresher. It's for your group health plan. It's only if you have 250 employees or more. If you have less than 250 employees, good time to take a break, go get a refill on your coffee. It's medical only. You do not have to do your standalone dental and vision. You don't have to report HRA, HSA. It's your medical plan. How do you calculate the premium? You calculate it if you're self-insured by COBRA rates. It's the easiest way to do it. If you're fully insured, just take the actual premium that's charged. There are, of course, nuances with everything. You know, what if I started out as a single and then I'm a family and all of that kind of stuff? You'll figure that out. Your payroll people know how to calculate this. The big takeaway from this right now is, as I said earlier, if I worked for you last year and I work for you this year and in the middle of the year I change jobs and I need my W-2, you have to have this ready to go. You have to be able to give it to me. So just go back to your shops and make sure that your payroll departments are ready to be able to do this for you. Okay, we seem to be good on that. Okay, this one of my favorites, comparative effectiveness research fees. So some of the money that's going to be made available to fund the Affordable Care Act is going to come through CERs. They start this year, $1 per participant. A participant is a per member. It's a per member per year. It's not a per employee. So it's a per member per year. You're going to pay $1 per participant this year, $2 next year, and every year thereafter. If you are self-insured, you will actually pay that fee on the appropriate form by the appropriate date. If you are fully insured, your insurance company will collect that and pay that on your behalf. This is, again, you just have to do it. There isn't anything to think about other than, for some of you, this is a line item budget that you might not have thought about. So let's just say you have 500 employees on the plan. This isn't on the plan. You have 500 employees, and so maybe with all of their dependents, you have 750, 1,000 people. Let's do 1,000 because that's easy. That's $1,000 this year. That's $2,000 next year. Not a big deal. You can probably handle that, but it would be nice to know. But let's say you have 8,000 employees, and with those 8,000 employees, you have 12,000 all in when you add their dependents. Well, that's $12,000 this year, and that would be $24,000 next year. To me, that's a line item budget that I'd want to know about because I think that starts getting into material. So just think about it, do the quick calculation. If you need to add it to your budget, now you know to do that. Good. Okay, this is the one that's kind of sneaking up on people. So starting January 2013, there will be a couple of new taxes that will show up via payroll through the employee benefits arena, and those taxes will hit highly compensated employees. And here's how they're defined. If you make $200,000 a year or more as a single, or $250,000 as a family. So I'm going to guess everybody in this room represents an organization that has some tier of employees that start there and go up. And I'm pretty sure that many of them have advisors, and at some point they will know about these taxes, but just in case, this would be a really good opportunity for you to let them know about the investment income and the wages earned income. I'm going to start with the bottom first because that's easy. That's going to end up being a couple $1,000s. That is not going to be hugely material, other than if you were not expecting to have that deducted from your paycheck, then it would be like a nice to know kind of thing. But it's just under $9 per thousand over the threshold. So do the math. If somebody's making $300,000 or $500,000 or $1 million, you can figure that out. But that in and of itself is not as big a hit as the investment income. And that's on what heretofore had been passive income that was not taxed at that rate. And now it will be taxed at 3.8% adjusted gross income. And again, 200 single, 250 family. If I have confused all of you, that's great, because Terry HORAN tells me he has a newsletter coming out this week that's going to address that. So stay tuned for more guidance. Call us if you have people impacted that you need more direction on how to communicate it and what's going to be involved in it. But just know that that's coming down the road, and we think is a good communication opportunity for you.
How are you to know what their joint?
We have this joint income conversation all the time.
Well, we don't, but remember, this is the individual's obligation to pay. This will be a new item on the Form 1040, and it will be the individual who's going to pay the 3.8% tax. And remember, it's a surtax, so it's in addition to all other taxes, doesn't work into the alternative minimum tax. This will be in addition to my AMT or any other taxes that I owe.
So I can see the brain cells clicking for some of your organizations. This is a pretty important fact for people to know and to plan for. Okay. Summary of benefits and coverage. So this is going to be really fun for everybody here, because this is not size limited. This is not time limited. This is not based on your funding selection. We're all in this one together. So I'm going to let Bill take you through what the requirements are, and then I'm going to give you some options on how you might want to most effectively actually distribute these materials.
The summary of benefits and coverage is a new feature of the Affordable Care Act. Incidentally, it is something that the Department of Labor indicated it was going to prescribe whether or not it was included in the Act. The summary of benefits and coverage is intended to do three things for individuals. One, alert them in plain English language as to what their group health benefit plan covers and what it doesn't, what the individual's out-of-pocket, co-payment, co-insurance, and deductible responsibilities are, and what the plan covers for both in-network and out-of-network benefits. Second, the summary of benefits and coverage tells employees their rights. What and under what circumstances may they appeal a decision and how they do it. Third, it gives them a graphic illustration of what a health condition might cost them under their plan. And it gives two illustrations. One is having a baby, the other is type 2 diabetes. And it takes average costs and shows them under your plan, here's what your out-of-pocket costs will be, and here's what the plan will cover. It is a prescribed document. You must use the DOL's form. It is 4 single sheets of paper on both sides. It is 8 pages long. You can download it from the Department of Labor's Affordable Care Act website. In addition, you can download a Microsoft Excel spreadsheet. You enter the variables about your plan. What are your co-payment? What are your deductible obligations? It will generate and fill in all the dollar numbers. It has a big disclaimer. Remember, for type 2 diabetes, how do I know what the cost is going to be? And the answer is, HHS has made up numbers for you to use. Now, they are nationwide median numbers based on adjusted Medicare experience. So there's a disclaimer that says these numbers are mythical, they are merely illustrations. Don't change that language. You must use the form precisely as it's printed. That's what we're going to be obligated to distribute. When must we do it? Enrollment or re-enrollment for periods beginning on or after September 23, 2012, for those of you that have calendar year plans that will be conducting open enrollment in the coming fall, you're going to be obligated to distribute these forms. You must also do it for new employees when they enroll. You must provide them with the form. You must provide it at special enrollment times. You must provide it on request. So if an employee who is not currently enrolled requests a copy of the SBC, you must provide a copy. Who must provide it? It is the responsibility of the sponsoring employer to provide this. As a practical matter, for those of us who work with self-insured health benefit plans, we're going to have to work with our TPAs to create the forms and make sure that we're correctly identifying who is supposed to get it and when they're supposed to get it. For those of us who are working with fully insured plans, it is a joint responsibility between the plan sponsor and the insurer. Insurers will be happy to prepare and distribute the forms, but they're going to need names, addresses, et cetera from you. So you're going to be working with your insurer and your broker to make sure that we correctly identify precisely who's going to do what. This is coming right up, so I would suggest you at least make an inquiry with your TPA or broker to make sure that it's on somebody's work list to make sure that it gets done.
So on the practical application of this, we should start getting phone calls from you on Monday, now that you know about the timing of this, and that's okay, because we're ready for those calls. Here's the good news. Your insurance company or your TPA/administrator, they're going to provide the documents. Don't spend a lot of time downloading stuff and trying to figure out what to put in what, because that would not be a good use of your time. There are lots of people out there who are getting ready to do this for you. Here's what you have to think about. You have to think about how you're going to distribute it, because your carrier can only send it to people who are enrolled, right? That's the only people they know. So if you are counting on your carrier to distribute this for you, not a good solution. Your obligation is to distribute this to everybody who's benefit eligible. Now we're going to start that this year, but I'm going to fast forward you to next year when the Affordable Care Act kicks in, and you may have many more people in that pool who are now benefit eligible. And then you have, you know, sort of the goofiness about where people live, and do you have addresses, and do they have addresses, and all of that kind of stuff. And then you have the mid-year hires and the qualifying life events again. So, you know, I picked this plan, and now I'm married, or now I'm not married, and I want to pick another plan. So you've got to really think about this on an ongoing basis. And what I said in my kumbaya moment that united all of you here, this is for everybody. Doesn't matter how big, how small, doesn't matter what you're funding in, doesn't matter what your plan is. You all have to do this. So I'm going to say two things. If you are a single site employer and you are less than a couple hundred employees, there's a pretty good chance, if you are in a manual environment today, that we can help you continue that manual environment. But if you are multi-site, multi-state, more than a couple hundred employees, and you have activity throughout the year as it relates to your payroll, you really want to think about an electronic enrollment system. You want to think about it for the SBC distribution, obviously, but wait for it. In 2014, it is likely that you are going to have to automatically enroll people into some kind of benefit plan, because that's part of the act. So within an 18-month time frame, you're going to have to do two things that are going to touch every employee. Starting this year, you're going to have to communicate with them in a prescribed hard copy or electronically distributed hard copy benefit plan. And next year, if you are 200 employees or more, you're going to have to automatically enroll them into something. I want to give you permission to have that big sign out, because I don't know how you're going to automatically enroll people and manage the communication process with that if you're not thinking about an electronic enrollment system. So there are great solutions in the marketplace. This is going to be a big deal expansion in that side of providers. Give you an idea, cost is somewhere between low end $2 per employee per month, high end $5 per employee per month. Think about that. Got a question back here.
With all these numbers of how many employees, I saw one slide you were talking about how many W-2s you issue. Now we actually have a lot of turnover, so that really affects it. And also you don't know how many you're going to have during the course of the year. Is that number by W-2s, or 200 or more is the most you've ever had at any point in a year?
Guidance has not yet been issued. This, in theory, is supposed to take place January 1, 2014. The Internal Revenue Service has reported that their colleagues at the Department of Labor who have regulatory authority are unlikely to tell you the answers to those questions prior to 2014. As a result, there is a material probability we won't have to do this until 2015. But we don't know the answers to those questions.
But we don't know. So let me just take you through a couple of other things, and then I'll give you some thoughts about that. So as you can see, the guidance is forthcoming, and we're going to talk a little bit more as we get into the pay or play about default plans. Here's the problem if you decide to go with an electronic enrollment system. You need to be ready to go 6 months before you go live, because you have a lot of data feed, testing, piloting. We need to know what carriers, we need to get information back and forth. So you can't find out in the third quarter of 2013 that you have to do this and do it. You need to have a plan. You don't need to execute. You absolutely don't need to execute. You don't need to spend a nickel, by the way. But you should be thinking about, if I have to do this, how do I want to do it? And if I want to do it electronically, what are the solutions that are available? What meets my needs? What will it cost? At what point do I need to make a decision about that? And then you'll figure out when to pull the trigger. We think that the 200 employees or more, you're going to do snapshots during the year. You're going to start with, and we think it's all going to be full-time eligible employees. And we think you'll look at it in January and you'll make a decision based on that, and you'll look at it in June and you'll make a decision based on that. And we think that there's going to be some leeway, but I don't think there's going to be that big of, it's not going to be the difference between 190 and 200. It's going to be the difference between 190 and 400. And when you're over 200, you're going to have to do this. So it's something we're thinking about now, because there's so much startup time and planning that goes along with that process. Not to mention that there's so many great solutions out there. You'll have lots of choices to make. It's not like a one-size-fits-all. Okay, so everything we've talked about so far, it's just insurance stuff. I mean, it's things you have to do to be compliant with the law, but it's all insurance stuff. Now, right on schedule, pay or play. What's it going to cost you to do all of this?
Remember what an exchange is. And a question was asked about this earlier. An exchange is going to be nothing other than an internet platform administered by a state on which commercial insurers will be offering group health or individual health benefit plans. By statute, and this was not challenged and the Supreme Court has not questioned it, all of the plans offered on the exchanges will have two things in common. First, the plan must contain the essential health benefits package. What is the essential health benefits package? We'll talk about that in a moment. Second, the plan has to have a certain minimum actuarial value. What is the value of a plan? The denominator are the total claims likely to be paid under the terms of the plan, total claims eligible to be paid, that's the denominator. The numerator, what portion of that is the plan going to pay as opposed to you, the participant? Remember, most participants today have deductibles and coinsurance of one kind or another. They're tending to pay the first dollar of some portion of the claims and continuing dollars thereafter. That's not paid by the plan, correct? The higher I set the deductibles, the lower the actuarial value of the plan. Where is the break-even point? When my deductibles and total out-of-pocket obligation begins to approach $6,000, for most plans, their actuarial value will be about 60%. That is, with a deductible and coinsurance obligation of around $6,000, for most plan, the individuals will pay 40% of claims for the year, and the plan will pay 60%. As that deductible obligation goes down, the proportion paid by the plan goes up. Exchange plans can be designed to be a 60% plan, a 70% plan, an 80% plan, or a 90% plan. Bronze, silver, gold, or platinum. These will be operated by the states. The states can choose how to operate it. If a state chooses not to operate an exchange, the federal government will operate one as agent for the state. What is the essential benefits package? All the plans must offer the essential benefits package. The essential benefits package are 11 categories of coverage, all detailed on your slide. Now, the Department of Health and Human Services made a strategic decision. Should we detail exactly what should be covered in each of those 11 buckets of care? DHS decided not to do that. Instead, what they said was, let's take a look at a benchmark plan in every state. Whatever the benchmark plan covers, that's it. Benchmark plans. The benchmark plan is any of the 3 largest small group plans by enrollment, any of the 3 largest state employee plans by enrollment, any of the 3 largest federal health benefit plans by enrollment, or the largest commercial HMO in the state by enrollment. Each state is obligated to choose one of those. It becomes the benchmark plan. Whatever its plan design is, that's the essential health benefits package for that state. Notice that if I am doing business in more than one state, my employees might have slightly different essential health benefits depending on what state they're enrolled in. If a state refuses to make a choice, the default is any of the largest, it's the largest small group plan by enrollment in that state. 3 days ago, the Department of Health and Human Services published the lists by state of the largest small group plans by enrollment for every state. In Ohio, it's 3 Anthem plans. Those are the benchmark plans. Ohio, Indiana, and Kentucky have all applied for and received small amounts from the federal government to do the initial planning to put their exchanges in force. Of those 3 states, 2 are fairly along in the process. Kentucky and Indiana are fairly along in the process. Now remember, in theory, these exchanges have to be up and running on January 1, 2014. And that's a lot of planning to be done. Ohio has done nothing. They've basically not done anything. So perhaps they were hoping that the act would be held unconstitutional. It was not. This is going to take place. Planning for the employer level pay or play requirement. Now remember, as we do this, we need to do 2 things. 1, remember who is eligible for a credit if they purchase a plan on the exchange. Who's eligible for a credit? Anyone whose household income is more than 100% of the federal poverty level, but less than 400% of the federal poverty level. Second, we have to remember what they're going to have to pay for that plan. As your income goes up, your share of the cost of the premium goes up. At 100% of the federal poverty level, you're expected to contribute 2.5% of your family income toward the premium. At 400%, that's where the credit disappears, you're expected to contribute 9.5%. If you have an employee who's making $80,000 a year, that's 350% of the federal poverty level, she is expected to contribute 9.5%. Let's keep this simple. Shall we make it 10%? Just for math purposes? 10% of $80,000 is? She's expected to contribute $8,000 toward the premium. The credit will cover the rest. What's the average premium today? Just so you know what average premiums are, $5,000 single, $12,000 to $15,000 family. That's the average premium in the United States. So if our exchange-eligible person purchases a policy, that's about what it's going to cost her. Remember those numbers, okay? What happens if an individual with income more than 100% of the federal poverty level fails to either enroll in her employer's plan or purchase a policy on the exchange? She must pay a penalty. The penalty is $695 or $95 for the first year, escalating up as time goes on. How many of your employees, particularly your younger employees, facing the choice might opt to pay the penalty? Remember, you want younger employees to enroll, do you not? Particularly for our self-funded plans, because they're subsidizing costs for the older employees. The federal government would like them to enroll as well in an exchange plan, because those premiums are based on community ratings. This is a new feature of the Act. In the small and individual group market, all based on community ratings. Right now, for many of you, if you're fully insured, all or a portion of your premium is based on your claims experience. That will no longer be the case in the small group market, and as soon as large group market plans, incidentally, what's small group versus large group? The magic number is 100 employees. 100 or less, small group, more than 100, large group. When the exchanges begin offering employers the opportunity to purchase group health plans on the exchange, and they are large employers, community rating for large fully insured plans as well. Remember, that's going to shift costs in the short run, is it not? Imagine everybody on this side of the room, you're employed by startup company. Startup company, it's a tech startup company. You all have highly decorated cubicles, and you are all under the age of 32. Everybody on this side of the room, you're employed by a fictional old-line steel manufacturing company, AK Steel, a totally mythical company. You're all over the age of 50. If we simply look at premiums based on individual experience, who's paying lower per member per month premiums and who's paying higher per member per month premiums? Startup companies paying much lower premiums. Why? Because the older you are, the higher your claims are going to be. It's about a 5-to-1 ratio from age 18 to age 65. So their premiums based on individual rating are about 1/4 of yours. What's going to happen as a result of the Affordable Care Act? When we switch to community rating, AK Steel, what's going to happen to your premiums? They're going to go down rather dramatically, all other things being equal. Startup company, what's going to happen to your premiums? They're going to go up. We need to, for those of you in the small group market, you need to start keeping that in mind. That's the third fact we need to keep in mind. Last fact, the employer pay or play penalties. How do they work? First, they apply to applicable large employers. If you're not an applicable large employer, you don't have to worry about the penalties. All you care about is what is it going to cost me to continue to provide employer-sponsored group health coverage, and is it worth my while to do it? You will not have to worry about these penalties. What is an applicable large employer? An applicable large employer is an employee if the employer employed at least 50 full-time employees during the preceding calendar year. These penalties begin in 2014. To determine whether for 2014 I'm an applicable large employer, I will look to year 2013, and I will ask myself, during 2013, did I employ 50 full-time employees? I have just used a phrase in English, correct? Solely for the purposes of determining whether I am an applicable large employer. The term full-time employee means the sum of A plus B. A, all of my bona fide full-time employees. Who are they? Anyone who is regularly scheduled to work 30 hours per week or more. Now notice the magic number, 30. There is no other statutory provision in the United States Code that uses 30 hours for any purpose. Whether you're looking at workers' compensation, eligibility or coverage for age discrimination and the size of the employer, determining who is an eligible employee for your company's 401k plan. We've never used this number before. This is a brand new number, so payroll won't tell you the answer. They're used to using different numbers, 1,000 hours a year, 35 hours for most group health benefit plans. Take your number of bona fide full-time employees, those regularly scheduled to work 30 or more hours a week. Take your non-seasonal part-timers and convert them to their full-time equivalents using the 30-hour-a-week standard, or 130 hours a month. Add A plus B together. If it equals or exceeds 50, you're an applicable large employer for calendar year 2014. That's how it works. That's the only time we use part-time employees.
So to just take a breath for a minute here, this doesn't happen until 2014. You have time to review the treatment of part-time employees in your organization. So what does that mean? A lot of you have part-time employees who work 32 hours a week. They're going to be benefit eligible at 32 hours a week, and they might not be benefit eligible today. That's however you've designed your plan. You have to make the decision if people are going to now become benefit eligible, do you want them to be part-time or full-time? Because once you start adding benefits to the cost of that employee, you might want another 8 hours out of them. You might also say, you know what, I don't need to have you at 32 hours. I need to have you at 25. Because that's the billion-dollar number, isn't it, for you? So what you need to be thinking about is this part-time group that you have, how you want to work with them on a going-forward basis. And one of the things that you need to start thinking about is a time and attendance record-keeping system. Because if you decide you want to have people work less than 30 hours a week, you got to be able to track it. You got to be able to train your supervisors. You got to have contingency plans for vacations and when people call in sick, and you want to give yourself enough space that somebody who's working 28 hours a week or 29 hours a week doesn't magically become a benefit eligible employee because they get called in. So it's just one of those things, again, it's a planning thing. Think about it, you've got time to implement it, but I wouldn't want to be thinking about it in the third quarter of 2013. I'd want to start that process now. We have a question over here.
The question was, what do we do about co-ops, interns, summer associates, and the like? There is an exception for seasonal employees. They don't count. And they can be disregarded. They are non-entities, non-persons. Send them off to Siberia, to the benefit Siberia.
Got a question here?
So you got a parent company that has 6 entities underneath of it. 2 of them have more than 250 employees. The rest have less than 50 employees.
Can I do this on a company-by-company basis as if I'm part of an affiliated group? And the answer is no. The service thought about that. You must consolidate all members of the affiliated group and treat them as a single employer for purposes of making these determinations.
One's union, the rest are non-union.
You must consolidate them all together for purposes of determining whether you are an applicable large employer.
Yeah, there are some things over which we have no control, and that would be called life. Couple of other things that usually come up in this context. Julie Topel, you had a question. So this is a counting question that came up yesterday. If I have legitimately waived coverage because I take coverage through my spouse, or I am a 25-year-old who is on my parents' plan, in the counting part, am I a full-time benefit eligible employee, or because I've waived and I'm covered elsewhere, am I not? And that makes a difference if you're on the cusp.
You count. For purposes of determining who is whether you're an applicable large employer, subject only to the exception for seasonal employees, you count all your employees, whether they're eligible for benefits or not, to determine whether you're an applicable large employer. Let's assume that you are an applicable large employer. You've made the count, you're more than 50. So here's how it works.
Well, just remind us to get back to that when we do the penalty. So you count for the 50 or more.
Now let's apply the penalties. Are you ready?
We'll do that now.
If you're an applicable large employer, you must navigate 2 penalties. Penalty number 1, if you are an applicable large employer, if you do not offer employer-sponsored group health benefit plan coverage to all of your bona fide employees, you may have to pay a penalty. You will have to pay a penalty if at least one bona fide full-time employee is eligible for the new premium tax credit and goes to the exchange and has the gall, the temerity, to apply for an exchange plan. If you let them straggle to the computer and attempt to enroll, you may owe this penalty. Second penalty. Even if you offer coverage, notice you're under the new act, you're going to be required to offer coverage to all full-time employees or pay a penalty. Second penalty, even if you surmount the hill of penalty number 1, your plan must be affordable and must offer minimum value. If it does not, you're exposed to penalty number 2. What is affordable? The employee's share of the premium must be less than 9.5% of her household income. What don't you know in order to determine whether you comply with this requirement? You do not know your employee's household income. And in fact, if you were to inquire about it, the odds are you have broken any number of federal and state statutes. So notice, in order to determine this, you can't figure out what the answer. Without figuring out the answer, you have no idea whether you're compliant. The Internal Revenue Service has proposed a safe harbor for you. You can use the employee's W-2 wages. Now remember, for those of your employees who are married, you are wildly understating their household income, are you not? It's guaranteeing what the result will be, but you're probably paying too much. So number 1, you have to make sure that the premium is less than 9.5% of household income. You can substitute employees' W-2 wages. Second, the plan's actuarial value must be at least 60%, which means as a general rule, you're going to have to keep the employee's cost-sharing out-of-pocket obligations south of around $5,500, give or take. When you start creeping up, beyond $5,500, there's a material probability when we use community rating experience, average claims for the community, you're going to begin to drop below 60%. Now, the world doesn't come to an end. I mean, if you fail either of these two tests, it means you're exposed to a penalty. Well, shall we learn what the penalties are?
Bill, is that $5,500 per individual or family?
That is cumulative total family exposure. Notice 2011-36. For purposes of determining who is a full-time employee, who is a full-time employee, what's the likelihood? Now, incidentally, on our exposure, if it's single coverage, it's clearly single. Where it's individuals, you have your own individual exposure. That's okay. If you have a $5,000 deductible per individual, that will still work. You'll probably still be at the 60% level. Now, how do I determine who are my full-time employees? Because remember, if I don't offer coverage to all of my full-time employees, I hit penalty number 1. The service has proposed a look back. Look back to the previous year. Identify who your full-time employees were in the previous year. They are deemed full-time for the following year. Now notice this only covers your current employees. What do we do about new employees? The service proposed a 2-part test. For my new employees, if you know on the date of hire that they're regularly scheduled to work more than 30 hours a week, they're full-time. Why is this important? 1, the penalty says you must offer coverage to all full-time employees, correct? The second thing the Act says is the maximum waiting period cannot be longer than 90 days. Many of you have longer waiting periods right now. Beginning in 2014, the waiting period shrinks to 90 days. You need to comply with both of those. I need to comply with the 90-day requirement. I need to determine whether it's worth having a penalty or not. For new employees, if they are regularly scheduled to work 30 hours a week on the date that you employ them, they are deemed full-time. They must be enrolled within 90 days. What if on the date they're hired you don't know for sure? Wait 90 days, look back. If they in fact work for 30 hours a week and you think they're going to continue to do so, they are a full-time employee and they must be enrolled by the end of day 180, because 90 plus 90 is 180. The Internal Revenue Service has also announced, we don't think this guidance is going to work. They issued it about 6 weeks ago, 7 weeks ago. They've already gotten adverse comment. So on this slide, your notes are, I don't think this is going to work. The service is likely to give us new guidance for these folks.
But back to what we talked about a couple minutes ago with this whole planning process, you really have to know what your part-time current population is, how you feel about that. Do you want more part-time or less part-time? Because those decisions that you make now that are going to guide your strategic planning are going to actually tell you if you want to be in a penalty mode or don't want to be in a penalty mode. And here's the other thing. We all, as an industry, we got to come up with a better word than this penalty thing, because we say penalty as if it's a bad thing, and you could be advantaged. And we're going to go through a couple of examples, but we're already at that 9 o'clock hour, so not nearly as many as I would have liked to. But that penalty is just a way for you to decide if you want to pay money here, if you want to pay money there. And sometimes that paying money over here, that's a better play for you. So know who your part-time employees are and what you want to do about them, and then you can decide how you want to handle it financially.
What is the penalty? Penalty number 1, if I fail to enroll all of my full-time employees, if I choose not to do it or I fail to do it, the penalty is $2,000 times the number of full-time employees minus 30. I get 30 for free for purposes of calculating the penalty, and many of you have heard this before. Remember, if I am let's say I'm an applicable large employer, I have 18 full-time employees and 42 part-time equivalents, and that's what made me an applicable large employer. Notice I owe no penalty, correct? 18 minus 30 is 0. But if I have 500 employees, 450 of them are bona fide full-timers. If I don't offer coverage to all 450, the penalty would be 450 minus 30 is 420 times $2,000. Now, of course, if I'm not currently offering coverage to all my full-time employees, remember in 2014, one, my plan will have to be non-discriminatory. I may have to include more full-timers whether I like it or not, correct? Imagine that right now I have 500 employees. I'm a fully insured plan, and I'm only offering coverage to the 10 full-time employees whose last name is Jones. The names of the company is the Jones Manufacturing Company. And the only people who are being covered are members of the owner's family. You know, that's perfectly permissible today. It will not in 2014. I'm going to be looking at having to add a lot of employees in order to have a non-discriminatory plan. The rules are very similar to those we use for qualified retirement plans. Whether I'm concerned about the penalty or not, I may have to add full-timers. In addition, I've got this penalty issue, correct? Which is cheaper. Adding enough to satisfy the discrimination requirements, adding enough to avoid the penalty, or doing away with the plan entirely and paying the penalty. How many additional employees must I add to my plan? Will the cost of coverage be more or less than $2,000? Imagine in my simple case of 500 employees, full-timers. I've got 500 bona fide full-timers. I'm currently offering coverage to only 50 of them. In order to make the plan non-discriminatory, I'm going to have to add at least 50 more. That takes me to 100. Question, what do I do about the remaining 400? Choice one, add them to the plan. What's the incremental cost to the employer going to be? Will it be more or less than $2,000? If the incremental cost is going to be substantially more than $2,000, what might I seriously consider doing? Not adding them, right? Not adding them. My plan's still non-discriminatory. I added enough to be non-discriminatory. I won't add it to the rest. I'll owe the penalty because it's cheaper. That's the kind of calculation we'll have to do.
So we're going to have to speed through some of the slides, but so here's what you have to think about. In your roles as HR and financial executives of companies, you're responsible for acquiring, retaining, and managing employees. They have to want to come to work every day. They have to want to come to your place of work every day. You need to be an employer of choice, and you probably rightfully consider your employees among your greatest assets. So what you have to think about is, how will my employees feel if I get out of the benefit distribution business? Is that a good thing or bad thing? And will they come to work for me tomorrow? Because if they're not going to come to work for me, it's really not about $2,000 times noses. It's about how do I stay in business. So that's one thing that you have to plan for. The second thing you have to plan for is, in our Jones Manufacturing example, if I discontinued benefits altogether, because then I would have a non-discriminatory plan, there are some number of people, I think there were 10, whose last names were Jones, who will ask to buy their benefits, right?
To the exchange.
So let's send them to the exchange. Let's have them buy family coverage. Let's say that family coverage is $15,000 a year. Let's say that we gave them a raise, but oh, wait for it, they're going to buy it with post-tax dollars. When they were buying it through their employer, they were buying it with pre-tax dollars. So that $15,000 cost needs to be grossed up because they need money in addition to that $15,000 just to get even with a benefits package that they're buying on their own versus a benefits package that you provided to them as an employer. Now, in a small manufacturing company named Jones, you can probably work your way through that. But in a large company with 2,000 people on the plan and 25 senior executives and 150 managers, that could be a pretty expensive proposition. And the question is, if you're not willing to do that, will they come to work for you? Or will they go to work somewhere else? So that, again, is part of the impact analysis that you have to think through beyond just the math. Make sense?
Second penalty, it works a little differently than the first one. Remember the first one, if I don't offer coverage to all my full-time employees, I owe a penalty equal to $2,000 times the number of full-time employees. It's triggered if at least one credit-eligible individual enrolls in an exchange policy. Second, penalty, even if I offer coverage to all full-time employees, if the plan is not affordable, premium is more than 9.5% of household income, or its actuarial value is less than 60%, I owe the second penalty. The second penalty is $3,000 times the number of bona fide full-timers who were A, credit eligible, which means their income was less than what percent of the federal poverty level? 400%, and more than 100%, and they bought a policy on the exchange. Do you see how it's different from the first penalty? First penalty just added up the total number of full-timers minus 30. This one only looks at the number of credit eligibles who actually enrolled in an exchange policy and got a credit. Now imagine that I'm working for Professional Sciences, Inc. It is a company that consists of professional engineers and other scientists, all of whom make more than $90,000 a year. I have a few non-highly compensated individuals, and they're making between $60,000 and $70,000 a year. What's the likelihood any of them are going to enroll in an exchange plan, regardless of the premium cost of my plan? Let's say the premium cost for single coverage is a little more than 9.5%. It's 10%. True, I'm technically exposed to the penalty depending on how many of them enroll. How many of them are likely to enroll? None. Anything, they're not going to get much of a credit on the exchange. In fact, my highly compensated will get no credit. They have to pay list price. My plan will always be cheaper. What if, on the other hand, my workforce consists substantially of people who make $40,000 or less? Notice if my plan's not affordable, it makes good sense for them to migrate to the exchange, correct? Because they will be eligible for a credit if my plan is not affordable. The more who migrate, the more the $3,000 penalty will be. Does that make sense? That's what we're looking at. Well, as we said, 9.5%, you can use W-2 wages. Which premium? Right now the IRS says the premium that we're looking at is the single premium. As long as your plan's single premium costs less than 9.5%, you're okay. Notice you can charge as much as you want for the family premium, as long as the single premium is less than 9.5%. Watch out, advocacy groups are lobbying against this. The service may be forced to change its position. We'll have to watch and see. How do I know whether my premium was less than 9.5%? Under the current proposed guidance, there's no look-back period. You have to make sure every year during the course of the year that it's less than 9.5%. For those of you, how many of you work at a company with a 401k plan? That's just about everybody. Remember, when you're testing to make sure that the non-highly compensated employees didn't contribute too much, you can use a look-back rule or you can use current comp. Many of you are using current comp. The service has said you got to use current comp right now. So you'd probably have to design the plan to guarantee on a payroll period by payroll period basis that the single premium will be X dollars or whatever you're currently using, but never more than 9.5% of wages for the payroll period. That would guarantee you that you will meet the affordability. As we said, for the most part, actuarial value, you don't look at your own claims experience. Guidance is we're going to look at community rating, community standards, and a recent survey showed 95% of all employers' plans met the 60% standard. Virtually everybody is over 60%. If your cost sharing per employee is less than about $5,000 to $6,000 per year, you're guaranteed almost for sure to be in that ballpark.
So let me jump in here, because Bill's got the clicker, so Bill's got control. A couple of things to think about with regard to this. First of all, pull a payroll run, do it now. Look at the bottom third of your employees' wages and start planning around that 9.5% of adjusted gross income around that bottom third. When we typically go through these programs, people leave here thinking, I've got to increase my contribution. Sometimes you just got to give them a little bit of a raise. It gets them out of that lower third. It gets them out of that 9.5%. So you could pay more for the plan. You could pay a penalty, or you could give certain people a raise to get them out of that federal poverty level. And sometimes that's the better option. So you kind of have to think about, you've already done that, but you have to really think about it. This is not a just plug and play. This is a really think about it, model it, make sure it works for your company and your employees. Second thing about actuarial value. So a 60% actuarial value plan is typically on the low side, and in this part of the country, it is typically on the low side. So what does that mean? It means there is a great opportunity for you between now and 2014 to add an additional plan of coverage. I'm not asking you to downsize your really great plans. I'm asking you to add a second or third or fourth choice that gets you just to the 60% actuarial value, because that keeps you compliant, and it does a couple of things. It gives people who are unwilling to take a lot of payroll deduction to get into your plan, keeps them out of the exchange because you've now given them a plan that meets requirements and that they can afford should you want them to do that. And remember my plea to you early in the morning when we talked about auto enrollment. So you will all have people who are going to be for the first time benefit eligible that you're going to enroll into a plan. Do you really want them in your highest level benefit plan? And if you do, have you thought about what their claims experience might do to the performance of your plan? And would you consider as a good alternative for your employees an entry-level plan that was at a lower benefit level at the 60%? It's all about philosophy. You have to decide what you want to do for your employees, but it's not a bad business play. It's a pretty good way to think about being compliant and managing the budget and taking care of your employees at the same time.
Very quickly, basic health plan is an option that the Affordable Care Act offers states. They can adopt a managed care plan that will be operated by a private company, so it's commercial insurance, designed for low-wage people. If your low-wage employee enrolls in this plan, they pay no premium or very little premium. They do not get the credit. For those of us working in retail, construction, restaurant businesses, we hope the states adopt a basic health plan, because if our employees migrate to that plan, I don't have to worry about the penalty. Remember that $3,000 penalty is $3,000 times the number of full-time employees who are credit eligible. They're not credit eligible if they enroll in the basic health plan. However, we think very few states in the Midwest are going to adopt this plan because the state has to take financial risk on the performance. They receive a capitated per member per month payment from the federal government, and the state's totally at risk for outcome. I don't think it's likely that, for example, Ohio or Illinois, given their current fiscal problems, is likely to adopt such a plan. So, if I have more than 50 full-time employees, how many are credit eligible? What's my cost going to be? Is my plan a better deal than the exchange plan? If it is, I probably won't have too much of a problem. I'm going to be looking at the costs of that benchmark plan, and if we take a look at what the benchmark plans are likely to cost, here they are. This gives you a good sense of what plans cost at various minimum value levels. Incidentally, the typical employer plan in the Midwest is very much like the Federal Employees Health Benefit Plan. It's also the Blue Cross Blue Shield Standard Option Plan. It has a fairly low deductible, $350, fairly steep coinsurance, 15%. That means you're always paying 15% of all health care claims. It has an out-of-pocket maximum of $5,000 per enrollee. That plan, incidentally, costs its premium. Does everybody see what the premium is? $5,000 single, $12,000 family. That's fairly typical. That plan has an 87% actuarial value. That's an 87% plan. On the other hand, a 61% plan has a $5,950 deductible and a 20% copay. So you can have a fairly substantial per employee deductible and still be at the 60% level. What do we need to know? Well, what's our cost going to be? If our cost is less than 9.5%, we're fine. If the single premium is more than 9.5%, one decision point is lower that premium exposure to avoid the penalty. I'm more inclined to do that the lower the average wages of my employees. Why? The lower their wages, the bigger the credit, the better the exchange plan looks. The more of them who migrate to the exchange, the higher my $3,000 penalty will be. So if I'm very close to 9.5%, it's cheaper to lower the single premium and thus become compliant than it is to have exposure to the penalty. Does it make sense, as Leslie said, to simply drop coverage? Should I just drop coverage and pay the penalties? As Leslie pointed out, and these slides will show, it doesn't make any tax sense if you have to do it for every employee. It's one thing to gross up 1 or 2 highly compensated employees. If you try to do it for all your employees, it will almost certainly be cheaper to continue to sponsor a plan. If my actuarial value is more than 60% and my premium is less than 9.5%, I'm compliant. One choice is do nothing. You're fine. Another choice, as Leslie said, over time, what might I want to do? If I'm at 87%, I'm not currently covering all my full-time employees. I want to avoid penalty number 1, so I'm going to bring in a whole flock of brand new full-time employees. What's going to happen to my costs? They're going to skyrocket, are they not? If I have an 87% plan, it means the plan is picking up 87% of every claims dollar. If I have to add 400 new full-timers who previously weren't covered, that's 400 times about 87% of average claims experience for their age. And remember, the older they are, the more expensive it is. That doesn't sound very tempting to me. What might I want to do? Lower the actuarial value of my plan. Drop it from an 87% plan to a 70% plan. I will save money, and that will subsidize the cost of adding new enrollees. And here's an example. What if my employee's average household income is $55,800, which is 250% of the federal poverty level? Well, if they go to the exchange and purchase a silver or bronze plan, 60% or 70% plan on the exchange, their total financial exposure is going to be around $9,000 to $11,000. If my plan is a 60% plan, charging them 9.5% of payroll, my plan looks better. In fact, if I use an 87% plan, my plan looks better. Their cost is only $88.50, and my plan's a lot better. But one thing I might want to do is to drop it down over time to subsidize new enrollees. But what if my average employee makes a great deal less, 150% of the federal poverty level? Let me warn you, my plan doesn't look nearly as good to them. They're only looking at their out-of-pocket costs, aren't they? That's a problem. I want to make sure in that case that my plan is a qualifying plan.
So one thing to think about on behalf of your employees. Bill has given you an actuarial value that looks at the employee's out-of-pocket costs. But I will tell you that my experience is that what your employees evaluate is their out-of-paycheck costs. They look at what the payroll deduction is. They don't look at out-of-pocket. What I worry about is you're going to have a bunch of people, first-time benefit eligible, in a low-level benefit plan with a $5,000 deductible or a $6,000 deductible, and they will have no ability to pay that deductible layer. So for my provider folks in the room,
better control those deductibles. Get paid in advance.
Your challenge is, of course, accounts receivable, and you've all got strategies around how to get paid at the time an employee needs the service. But again, you got to think about it in the big picture. If I am a self-insured plan and I have to pay the admin on these people, but I'm going to have great experience because they're only ever going to access preventive health care, which is paid for at 100%, and we all think that's a good thing. Am I offsetting the cost of my big plan by bringing in not necessarily healthier people, but lower cost employees? So again, it's not a plug and play, do the math, times noses, and you have an answer. You really have to think about how this is going to impact all of your plan designs and all of your expenses down the road. Where are we? We're almost done here. Oh, okay. So I'm at the summary slide. Sorry. I tried to put this in date order for you because we have covered a lot of information this morning. So there's communication things that you should be thinking about doing. It will make your life easier and it will make your phones ring less often after the fact. So you got to figure out what you want to tell your employees about the medical loss rebates that have come back, what they're due, how you're going to send it to them, and you got to have a plan to calculate that. So that's internal. We've already talked about the SBC preparation. I would not lose a lot of sleep over the prep, because between your advisors, your carriers, your TPAs, your administrators, you're going to get the documents. Documents are not a problem. Distribution, you got to think about how you're going to get the documents to the people, starting with this open enrollment and on a going forward basis. Next thing you have to do, I think you want to talk to your highly compensated employees about some of the new tax implications, and we can certainly get you, we haven't prepared them yet, but we will. We can get some sample letters and things that you might use to send to your executive suite. How do you figure out who's impacted? Pull another payroll report. Anybody over $200,000 is probably the people you want to communicate with. We didn't spend a lot of time talking about it, but you know that next year you've got to limit your FSA contributions to $2,500. Communication initiative, probably going to handle that during open enrollment would be my guess, but it starts on a calendar year communication program, I believe. So if you're not renewing until sometime in the middle of 2013, you just might want to let people know that it's coming up so that they can plan appropriately. And then in March, again, this is going to be prepared and provided to you. Your problem is the distribution of the information. You're going to have to let your employees know about the exchange and what their opportunities to participate in the exchange are. The budget thing, you got to talk about the medical loss ratios. You got to talk about comparative effectiveness fees. If you're a big company, that's a big number. If that's that dollar per member per year for year one and $2 per member per year thereafter. So if you got 5,000 or 10,000 employees, I'd want to put it in my budget if I was running the HR department. And then we've talked a lot about this whole concept of auto-enrollment, not only how you just manage the distribution of paper and communication to employees, but what you want to get ready for 2014 or thereafter, should that date change, in terms of how you want to add people to your plan, and that leads to that whole discussion of, and good Lord, what plan do I want to add them to? So those are all your takeaways from today. We've got a few minutes if we have any questions. Ron?
On the exchange premiums, are they always with after-tax dollars?
They are paid individually. The employer would pay them. If the employer buys a policy on the exchange, same tax treatment as currently today. If I'm an individual and I purchase a policy, in theory it could be an itemizable deduction. If I'm self-employed, it's deductible currently. Same treatment as regular tax.
But if you're an employee of a firm that has a plan and you choose to go to the exchange, you would pay after tax.
Absolutely.
Correct.
Versus you get pre-tax.
That's right. That's why it almost never makes sense for an employee or employer to give up their coverage.
And then, Ron, to further complicate it, for the beginning year, so 2014, a large employer you can't buy your benefits on the exchange as an employer. You can send individual employees to the exchange. By 2017, there's some thinking around employers being able to buy their benefits through the exchange. So one last strategy that I didn't talk about, there's so much to do in such a short amount of time. You're going to start hearing, if you're a large employer, you're going to start hearing about private exchanges. Yes, some of you have already been there. So private exchanges, they're actually available starting this January, and the whole idea behind them is to allow you to move from a defined benefit program to a defined contribution program. It's not about having better or worse benefits, it's about managing what your spend is. So just think about that in 2014, I can choose to not cover my employees, not cover some of my employees, send them to an exchange where they can now get benefits, and it is a post-tax play for them. If, as an employer, I decide to just change up the entire way I think about providing benefits and go to a defined contribution approach through a private exchange, I'm managing the dollars, but I'm still taking the tax deduction as an employer. So that is a strategy that is probably only geared to a handful of people in this room, and if on your survey you tell me you want to know more information about that, we'll get a small group together, but I don't want to spend a lot of time on that concept if there's 12 people in the room that care about it. But
yes.
Those 12 people I do care about.
Are HSAs
No. Still going to be with us. You may still have them. This last slide, incidentally, just quickly gives you the overview of how we model for you. If I'm an applicable large employer, what should I do? Is my plan affordable? Remember, for virtually all of you, you meet the minimum value requirement. The only issue is, what are you charging for the single premium? Should I make sure my single premium is going to meet the requirements? What do I want to do about part-time employees? Remember, I'm going to have to cover all my, quote, full-timers. I need to manage what could be a new group of enrollees. Do I need to create a lower value plan? If my plan is significantly more than 60% and I have to bring on a flock of new full-timers in order to avoid penalty number 1, how do I propose to pay for the employer's share? One way of doing it is, as Leslie said, why don't we start thinking about lowering the actuarial value or offering a lower actuarial value of the plan? It might make sense to pay the penalties. When and under what circumstances? The older my employee, the higher the potential claims experience, the lower their compensation. Might be cheaper to pay a $3,000 penalty than to sweeten the coverage. Does that make sense? Those are the 3 big variables that we're going to deal with. Yes?
We hire full-time employees on a temporary basis sometimes, and temporary basis can go on longer than what you think. That's not really seasonal, but they don't qualify for benefits. I mean, how do you deal with that?
Well,
I'm going to hire employees. I call my new hires, I call them probationary. If they're regularly scheduled to work more than 30 hours a week, they're full-time.
Doesn't matter if they're so you've got to give them benefits. There's no way to get out of the benefits.
That is correct.
By calling them temporary.
You can call them whatever you want. Now remember, we saw that guidance in Notice 2011-73, which said for a new hire, if you're fairly certain they're going to work 30 hours a week for the indefinite future, they're full-timers. If they're not, you get a 90-day test period, but they may revoke that. You need to watch that. But any number of our clients they have this category called probationary. Why? Because they used to design their group health benefit plans to exclude probationary employees. That won't work very well after 2013.
So you
because
need
if
to
they're
think
full-time,
about-
that design may no longer work.
You need to be thinking about full-time employees versus 1099 employees versus employees you get through a staffing organization versus employees that might be part of a PEO. You just have to decide whose responsibility it is to provide benefits to different classes of employees.
Well, staffing service employees are not your employees, so
As a general rule, if you are leasing employees from a staffing service, they're the staffing service's problem as long as they have direction and control over the manner in which they do the job. PEOs, that's an interesting issue. They're probably taking the position that they're your employees. So it's something to think about. One more question, and then we'll let you run away. Run away.
Is there any reason to continue spousal coverage when the spouse is working for another employer?
No.
This was your question.
And some self-insured employers have been very aggressive about that. As long as you do it on a non-discriminatory basis, in theory, you can continue to do it. Now remember, some states are beginning to regulate that. There are a number of states in our area that no longer permit that plan design in the fully insured world. But
So-
we certainly can do it in the self-insured
so
world.
the question was about spousal coverage, and so you got spousal carve-out opportunities or spousal surcharge opportunities. We're thinking more recently we like the surcharge better than the carve-out because it brings some funding into your plan.
Right.
Just think about that because we're worried that as our plans have more and more singles, we have less and less premium to play with. And so just think about that piece of it. I see people scurrying to write notes on this. If anybody wants the full-size slide deck, I was just trying to be as green as I could and not print out 87 pages of paper, and every time I do a seminar and I try and go green, y'all yell at me and you say, I needed the slide deck to take notes. So that's why you have the
The
thumbnail
little
version.
miniature ones. This was a Vision Tech. This is free preventive healthcare service.
There you go.
If you can read it, you're fine.
But
if
I
you
see
can't,
you writing
see
notes.
these guys in the front row.
I am happy to send this to you, make your life easier. Bill and I will hang out here for a while. We are right at 9:30. We are so good.
We are so
We
good.
are right at 9:30. And so those of you who need to leave, feel free. You cannot insult us under any circumstances. I want to thank the crew at HORAN, who was just fabulous about organizing this and putting it together and getting the food and getting the tapes, and whoever my microphone guy was. I think he dressed me up really nicely. Can't see any wires. So thanks to all of you for coming. Thanks to the HORAN staff for putting this together. We are officially concluded.